So this was a study we did out of CALGB SWOG 80702. This was a phase 3 study for patients with stage 3 colon cancer that was testing 3 versus 6 months of adjuvant FOLFOX therapy and also 3 years of Celecoxib or placebo. And one of the things that we wanted to address was from the overall trial, there appeared to be a slight benefit of receiving Celecoxib versus placebo, although the statistical results didn't quite reach significance. And this hinted to us that there was probably a subgroup or subgroups of patients that were really benefiting from Celecoxib. One hypothesis that we had is that patients that were positive for ctDNA right after they had gotten their surgery might be a subgroup of patients that would have benefited from Celecoxib. And so working with our partner Natera, we did ctDNA testing that was tumor-informed on about 1,000 patients from the total 2,500 patients that were enrolled in the trial. And we looked at the prognostic and predictive value of ctDNA status after surgery before patients received adjuvant therapy and looked at that again with respect to prognosis and the predictive value of Celecoxib. You know, we've known for colorectal cancer for about the past 8 or 9 years that ctDNA positivity after curative intent resection is highly prognostic, and that's been shown across multiple studies, across multiple stages of disease, and that, you know, comes as kind of no surprise to us. We, of course, wanted to look at that in our cohort, so we started with that analysis, and we did find that baseline ctDNA status was strongly predictive of, if you were positive, shorter DFS, shorter OS. The hazard ratio for DFS was about 7. So that made us convinced that we were, you know, detecting about the right rates of ctDNA positivity, and that was kind of behaving appropriately as a biomarker in our cohort. Overall, about 19% of our patients were ctDNA positive. We then looked at kind of the more interesting question, which is whether ctDNA positivity can predict patients' response to Celecoxib. And when we did that analysis, we found that for patients that were ctDNA positive, Celecoxib actually offers a significantly improved DFS and OS as compared to patients that are ctDNA negative, where Celecoxib really has no effect. And if you look in that ctDNA positive patient population, the hazard ratio for Celecoxib versus placebo is about 0.55. And so DFS at 3 years was about 44 versus like 22 or 23%. So there really is this significant benefit to taking Celecoxib in the adjuvant setting, only if you're ctDNA positive in baseline. And that's an exciting result for us because this is one of the first sort of predictive uses of ctDNA testing that we have for selecting adjuvant therapy in colorectal cancer.